Welcome to 52 Questions. I'm Shannon Weber, Director of Hive. Every year, Hive answers hundreds of questions from patients, their partners, and providers. And each week in 2018, we're bringing you one of those frequently asked questions in video format. For this week's question, when do I take PEP or post-exposure prophylaxis? I've come to the National PEP line, and we're going to talk with Medical Director, Dr. Carolyn Chu, to answer that question. When do I take PEP?
Hi. So the most important thing to remember about taking PEP is that you get it started right away. Ideally, it would be within 48 to 72 hours of the exposure. We really encourage folks to try to get it on board within the first couple of hours, if possible, but we realize that might not be feasible for everyone.
And so, in what situations do I think about using PEP?
So the situations to consider PEP would be through condomless sex with a partner that you might not know what their HIV status is. And you could also be considered for PEP if there's any shared needle use as well.
And where do you recommend people go to access PEP?
The best place is probably the place that you can get in the quickest. If that might be a local emergency room or an urgent care center, or even with your primary care provider's office if you have one, and if they have same-day access. Really, the key is being able to get to talk with a provider face-to-face as soon as you can.
Awesome. Thanks for joining. Tune in next week where I'll answer the question, I'm afraid to talk to my doctor about PrEP. How do I bring it up? Thanks, and have a great week.